Hi, I'm Jessie Smith with Medicare Giving. This video is going to go over some big picture ideas for the two coverage routes that you can choose from when going on Medicare. Our goal is to show you how these different parts work together in these two different routes that you can go with. Let's start with Route 1, which is going with a Medicare supplement plan. In this route, you have Original Medicare, which are Parts A and B. Part A is your hospital coverage, and Part B are your doctor services. Original Medicare covers about 80% of your medical expenses, and there's no out-of-pocket maximum for those services. That is why we always recommend people either add a supplement plan or an Advantage plan. When you add a supplement plan, you're adding an additional plan from a private insurance company that helps cover in that 20% of costs that Original Medicare doesn't cover. Supplement plans don't offer additional services that are covered, they're just meant to fill in the gaps of cost. You'll also hear them referred to as Medigap plans. They're covering things like copays, coinsurance, and deductibles. Original Medicare and your supplement plan don't cover prescription drugs, so you'll also want to add a Part D prescription drug plan. Drug plans are also offered through private insurance companies, and which one is best for you is completely dependent on what medications you're taking and what's available in your area. Route 2 is a Medicare Advantage plan route. Medicare Advantage plans are HMO or PPO plans that bundle your different types of coverage. By law, they're required to cover the same services that are covered under Parts A and B, so that would be your hospital coverage and your doctor coverage. Many plans also offer additional benefits such as dental, vision, and hearing. Many plans also have prescription drug coverage included, so you don't need to add an additional Part D plan. Let's take a look at the pros and cons of each of these routes. In the supplement plan route, you don't have to worry about networks. You can go to any provider or hospital that accepts Medicare. Now, we're not going to dive into all of the details about what Part A covers, what Part B covers, and what your supplement fills in. However, the big picture is that once you hit an annual deductible of $233, your Original Medicare and your supplement plan are going to cover the rest of those medical costs. In this route, vision, dental, and hearing aren't covered. Some people choose to add additional plans for those things or choose to self-fund them. With this route, you'll pay more in your monthly premium costs. Your Part B monthly premium will be taken from your monthly Social Security check or billed to you quarterly. You'll pay a monthly premium to your supplement plan insurance company. Those rates are based on your age, your area, and which company you go with. The average supplement plan rates that I've been quoting recently for new 65-year-olds are between $120 and $150. You'll also pay a monthly premium for your prescription drug plan. Again, those rates are completely dependent on what drugs you're taking and what plan will work best for you. Some of them are as low as $7 a month, and the national average is somewhere around $30 a month. If you add all of those up, your costs in monthly premium are going to be somewhere between that $300 and $400 mark. I like to think of a supplement plan route as an all-you-can-eat buffet. Your cost of entry is that monthly premium and that meeting that $233 deductible, but after that, all of your services are covered. Let's compare that to a Medicare Advantage plan. In Medicare Advantage plans, you do still have to pay the Part B premium. However, these plans offer many low premium plans, even $0 premium plans. Like I said earlier, they cover dental, vision, hearing, and prescription drugs as well. Now, the costs that you pay on a Medicare Advantage plan are going to come in the form of copays and coinsurance. Those are required for many of the services that you'll use and can total up to your plan's out-of-pocket maximum. That'll depend on what plan you go to, but they can be as high as $3,000 to $7,000 a year out-of-pocket maximums. Something important to know about Medicare Advantage plans is these are PPO and HMO plans. So you need to go to in-network doctors and hospitals to get those lowest costs or for even those services to be covered at all. Some HMO plans require referrals or pre-approval for certain services as well. You can think of this plan as an a la carte style plan. You don't have the cost of entry in the premium payments, but you will have to pay for each service you use in coinsurance and copayments. Which plan is best for you is dependent on personal preference and what your medical needs are. Some factors to consider are how many doctors or specialists you see, if you travel often, what you can afford in monthly premium, and just your general mindset around your health care. Would you rather pay more in premium, like an all-you-can-eat buffet, but know that once I pay these things, my services are covered? Or would you prefer to pay less in premium and just know that there may be some unknown costs in coinsurance or copays down the road, like an a la carte style? An independent Medicare agent can help you navigate through those questions and provide quotes for different plans that might work best for you. Your initial enrollment period for Medicare is a 7-month window when you're first eligible to sign up for Medicare. It begins 3 months before your 65th birthday, the month you turn 65, and then 3 months after that. If you're working past 65 and you're still covered based on your employer plan, you can use a special enrollment period when you want to go on Medicare when you retire. Whether you're using an initial enrollment period or a special enrollment period, we suggest reaching out to an independent Medicare agent 3 or 4 months before you're wanting to start Medicare. They'll walk you through how to apply for Parts A and B through ssa.gov/Medicare. They'll help you decide which of those routes is best for you and run some quotes for you. You'll walk through the application process and make sure you're all set up for your effective date. If you have any questions, feel free to leave them in the comments or reach out via email or phone call. Check out our other videos for more information on Medicare and for resources to help you in this process. Thanks for watching. We'll talk to you soon.